I start case study presentation. Margaret shows signs of anxiety like nervous and panicky when she went shopping. And after a few minutes, she went shop when symptoms disappeared. Over the course of time, she was constantly experiencing the reaction, feeling even worse as her heartbeat accelerated, and she even thought that she would faint. Because of these terrible symptoms, she sometimes cries without reason. Recently, she had been feeling that anxiety before going shopping because she had been repeating the symptoms, and when she went to the shop, she could not breathe and was nauseous. When she thought about the situation in detail, she felt pain in her chest when she thought that others would look at herself and think she was stupid. At first, she thought it was a heart attack, but she remembered what she read in the book. In that book, people with panic disorder learn how to think they are going to die. Based on the contents of the book, she told herself that simplicity was a panic that made her feel dying. It helped relieve symptoms for 10 minutes, but again panic recurred and came out of the store. After 10 minutes, the symptoms was alleviated and she went back to the shop and finished shopping. First of all, I thought that it was agoraphobia for the place because it is symptoms that she felt when she went shopping. I think the individual with agoraphobia fears or avoid this situation because of thoughts that escape might be difficult or help might not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms. So, Margaret seems to be not agoraphobia because she could face again without escaping the situation. Although I was thinking of panic disorder while looking at her physical symptoms, panic disorder should peak at a few minutes when a panic attack came. And there should be worry about the possibility of more attacks for at least 1 month, and there should be a change of behavior caused by worry or attack on the result of the attack. But it does not exist. Above all, the panic attack happens unexpectedly without warning. However, in Margaret's case, it is not panic disorder because it is a symptom that she felt when others look at herself and think she is stupid. Therefore, I think Margaret is the most likely diagnosis of social anxiety disorder. The reason she feels insecure when she goes shopping is because she thought about what other people would think of her. The symptoms that Margaret said were physical symptoms that she felt when she thought about it. And when she thought just put yourself together, nobody cares, they are all too busy getting on with their own stuff, she got calm and she could get back into the store. Also, she feels like she is already feeling anxious before going shopping because such symptoms are repeated. The reason she feels so, she fears that she will act in a way or show anxiety symptoms that will be negatively evaluated. This is also diagnostic criterion for social anxiety disorder. Cognitive behavioral therapy was used to treat the symptoms of Margaret. Cognitive behavioral therapy is a change of thinking to alleviate symptoms. When she read the self-help guide on the internet and remember it all the time, the just pull yourself together, nobody cares, there won't stop. The idea was able to alleviate symptoms by changing her cognition. and it would be nice to praise Margaret's cognitive approaches and try to treat her with increasing confidence in her ability to deal with anxiety.